Welcome to Lung Cancer Foundation of America's World Lung Cancer Day social media takeover. If you're just joining us, today's a great opportunity to learn more about living with lung cancer and the important research that's going on right now.
You know, Mitch, earlier this year, we had the opportunity to visit with a member of the LCFA Scientific Advisory Board, Dr. Raymond Osarogiagbon. We affectionately call him Dr. O, and he's an oncologist at the Baptist Cancer Center in Memphis, Tennessee. And he likes to say he lives to conquer cancer.
I love that. Recently, LCFA Speakers Bureau member Brandi Bryant sat down with Dr. O to talk about what to ask your doctor on your next visit, what to ask that could potentially help identify lung cancer, and what to ask to help you fight your lung cancer. Take a look at Brandi and Dr. O's conversation.
So what questions to ask our doctor? I will start from risk, okay? If you are 50 and above and you smoke, ask your doctor, do I qualify to be screened for lung cancer? Now, if you've already been diagnosed with lung cancer, then you need to know what type of lung cancer do I have? And these days, what type of lung cancer do I have is not just the old small cell and non-small cell. It's what type of biomarker identified subset of lung cancer do I have? It makes a big difference because it makes a difference in survival. It makes a difference to treatment. It makes a difference to the convenience of treatment depending on what type of lung cancer you have. So for example, there are patients with the most advanced stage of lung cancer, stage 4, which traditionally the 5-year survival was 4 to 6%, okay? There are biomarker identified subsets of stage 4 lung cancer that have a 5-year survival more than 60%, 60%. That's one. Another is the convenience of treatment. So there are patients with stage 4 lung cancer who can be treated with a pill that they take by mouth once a day. Only have to see the doctor every 3 months. And then there are the traditional types where they have to take chemotherapy IV and they have to see the doctor every 3 weeks or thereabouts. Big difference. And the only way you can tell between one and the other is to get a simple test, a biomarker test. That's why biomarkers are important.
How does knowing your biomarker change your treatment plan?
Yes. So we talk about personalized medicine, meaning you got a cancer, there's a very specific treatment. I use the analogy of a lock and a key. The biomarker is sort of the lock, and the targeted treatment is the key that opens that lock, okay? You have to fit them exactly, match the right lock with the right key. And the only way you can open that door is to do that biomarker test, to know that you have the right lock and you have the right key. So biomarker testing is vitally important, and not every doctor, unfortunately, knows that. So patients sometimes have to be their own advocate. Ask your doctor, what is my biomarker? If you don't know that, why have you not asked for a biomarker test?
Asking questions helps not only you, but helps your doctor as well. Because as we've shared today, not only are there different cancers out there, but there are big differences between patients as well. Coming up later in the hour, we'll hear from Dr. O again on the key differences between small cell lung cancer and non-small cell